Good afternoon, everyone, and welcome back to another episode of Sunday Housecall. We want to wish you a happy and a healthy new year. My name is Dr. David Samadi. I'm the chair of urology at Lenox Hill Hospital, and we're honored to have my co-host, Dr. Sanara Kumar, with us.
Thanks so much.
Happy and healthy new year.
Yes, Happy New Year. I'm excited for 2018.
Absolutely. We all want to thank you for making us and being our fan for 2017. So many emails and texts and phone calls that has come. They love the program. They love all the guests that we've had. And this is also a way to really give back to the community. A lot of doctors in the middle of America, they may not have insurance. They may not have the time to go see the doctors.
Right.
So this really has become their Sunday, kind of like morning, afternoon, kind of depending on where you are, where they can like sit back. And on the website, drsamaditv.com, they can go and really get a lot of good information.
Yes.
So you can send your medical questions. We just got one from Scotland. We're live, and we can certainly answer them as we go on, or if we don't have time, we can come back to you. And also to a lot of physicians out there, if you're interested in coming on board and join us, depending on your expertise, we would love to have you. If you have published a book, Sanara, we can also discuss some of these books, anything that help the community out there with their medical issues, we're on board. You agree?
Absolutely, that would be great.
And also, we want to tell you that since we don't know the entire medical diseases of everybody, these are not specifically for you. This is for general public. You always have to talk to your doctor about like your specific issue. So, welcome back. I hope you had a good time being away with the family.
It was
you
nice.
Got some color, so you're well rested. That's really good.
I was in a warm spot.
That's
not like where I'm at right now, which is freezing in New York.
-4 degrees. We'll talk a little bit about hypothermia. So happy New Year again. Now, this is around the time of the year where everybody is talking about their new resolutions.
Yes.
We make them, and unfortunately, about 40% of Americans, in the first month, they actually break their resolutions. They can't keep up with it. And do you know that only 8% of us will finish the 2018 keeping up with what we actually decided to do? A very low number. I was actually quite surprised about that also. So tell me, first of all, some of your new resolutions. A lot of people want to know about what you're going to be doing.
Well, I have to tell you, I usually don't make New Year's resolutions because I don't want to be part of that 8%. But I did make a New Year's resolution for this year, and that's for me to go see my doctors. I don't know about you, but I do not like going for my checkups and going in to see my physicians. I'm always full of excuses. I'm too busy. I'm running the kids to their doctors. I don't have time for mine. But I decided this year it's exceedingly important for us to do that, maybe because I'm approaching a certain age I don't want to mention. But I think it becomes, and I think that for all of us, I think we need to keep in mind that going to your doctor is really important from a screening perspective, not just going in for the common cold or going in for the flu or going in because you really are sick, but you really want to keep on top of the screenings. And I think later on we're going to talk about the screening, some screening guidelines and tests for us to do.
I'm actually glad that you're saying it, which is kind of a surprise for me because I always say that women love to go to doctors. And I think because part of it is because of your surgical volume and the fact that you're busy. You're juggling too many jobs, being a mom and surgeon. It's very difficult. But in general, I think women love to go to doctors. They're very detail-oriented. They do their mammograms and pap smears. And men are kind of like left out. And we'll talk a little bit about this. Let me put up like some of the resolutions that people make every year. Most popular ones, as you can guess, is really to stay fit and get healthy. This is like a big ticket over here. What is your thought or any kind of like recommendation to people out there?
Staying fit is really important, and the American Heart Association has guidelines for just overall health. And again, as you said, keeping in mind, it's not necessarily for everybody, and it is important to speak to your doctors before you start an exercise program to make sure you can tolerate it. But they do recommend that we do about 30 minutes 5 times a week of moderate exercise, meaning a fast walk or maybe a slow jog, or doing 25 minutes 3 times a week of vigorous activity, which may be running or doing running on a treadmill or doing the elliptical trainer, so something a little bit more active than just a fast walk. And then in addition to that, also recommending 2 days a week of strength training. So that's their recommendation for overall health. And I think obviously, and not just for health, but I think for our well-being, our overall well-being, our mental well-being, exercise becomes really important.
It's very interesting because we talk about like these exercises or try to lose weight or stay healthy. but a lot of it is really broad, and I think it's not specific. So if you're like me, where you don't have a lot of time, I think being a little more specific would be perhaps a better recipe for you. Concentrating on, for example, like working on your stomach, or you're going to gain more muscles, or get trainers. You know, this time that you're talking about, 3 times a week, this is your time.
Right.
No schedules, nobody can break it.
Cell phones off.
Cell phones is off, and then, you know, and you may want to get a trainer to self-motivate yourself to actually do it. When it comes to better diet, I mean, we always talk about portion control, getting smaller dishes, maybe use chopsticks, any way to really like eat less. But the bottom line is, we've spoken many times about like Mediterranean diet. Try to cook at home if you can. Cut down on salt. What do you think about it?
The 3 top diets that I like, for at least for 2018, or that have come out of 2017. One is the Mediterranean diet, which I think is just, we love.
Absolutely.
It's the best diet, I think, just for overall health again, for preventing many diseases. It's been shown to be very, very effective. So that is a healthy portion of fish as your protein. So your main diet source for proteins is fish. Salmon being one of the better choices. And then fruits and vegetables with whole grains and a little bit of dairy. And limited amounts of red meat. The other 2 diets that I think are really good, one is DASH. It's called, which stands for a dietary approach to stopping hypertension. And I think it's an important part of dieting, right? So not always does our goal need to be to lose weight. It may just be for overall health, right? To reduce diabetes, to reduce our high blood pressure, to improve our cardiac health. So that's a dietary approach.
Reduce the risk of stroke, which we'll talk in a minute.
Exactly. And that's, I think, a very good diet in regards to approaching that. So their goal is to reduce sodium in your diet and increase the potassium and the magnesium. And then the other diet is the flexitarian diet, which is basically a vegetarian diet. Your proteins come from tofu and lentils and legumes. But it allows you to, every once in a while, have some red meat. So if you tend to crave it here and there, then you can add a meat product or fish or meat to the diet. But again, it's kind of a focus on fruits and vegetables and whole grains and a small amount of dairy. So I like those 3 diets as choices. And again, not just necessarily to lose weight, but to be in better health.
I like Mediterranean diet. We've spoken about this, and I agree with you. I think these are good cholesterol. Avocados, legumes, beans, you can get your proteins from there. But I also like the fun part of this, which is like your espresso, your coffee, all the antioxidants you get from that.
Yes.
You have the red wine, which is great. And DASH diet is absolutely, as you mentioned, is Americans are getting about 3,500 milligrams of like salt, and we should be somewhere around 2,300. And you should talk to your doctor about getting the salt out of your life, because it's hidden in a lot of our food, in bread, processed food, etc. So you want to be really careful, and that's really important. Losing weight, obviously we spoke about this, and this belly fat that we have inherited with whatever reason because of our nutrition and our health system is causing a lot of problem for us. Risk of heart disease, high cholesterol, etc. So pay attention to your body weight. And I think one of the easiest ways that we've spoken about was take your height, divide it by 2 in inches, and your belly circumference should be less than that. That's a very easy way. Obviously, when you go to your doctor, they talk about body mass index, which is a very complex formula that we can put it up on the website. I learned a lot from you. This is one of the reasons why we do this show. I had no idea anything about this flexitarian diet, but I like it because sometimes a little bit of red meat is okay. Moderation is fine. So that's good. Tell me about smoking, because, you know, some of the statistics that I looked at, in 2016, believe it or not, 1.6 million Americans are diagnosed with cancer. And smoking plays a huge part of this. The risk of dying from cancer, about 30% of it has to do with smoking, and this is so preventable.
Yes. There's just no getting around it. Smoking is bad, bad, bad. There is nothing redeeming about smoking besides the fact that it makes you smell bad. Or I should say, including the fact that it makes you smell bad. So smoking is just not, there's nothing good about it, not just from a cancer perspective, which, I mean, ovarian cancer is, you're at increased risk for ovarian cancer with smoking, increased risk of lung cancer, but just pulmonary diseases like COPD, which is chronic obstructive pulmonary disease, and bronchitis and emphysema. And these patients suffer when they get sick with these types of diseases. So it's a shame to see that. You know, I often am so heartbroken when I walk out of the hospital and some of the patients who are in rehabs or they're there for long-term illnesses, they're allowed to go outside and I guess take a smoking break and get some fresh air. And I see these patients just suffering, having difficulty breathing, but yet they're still can't break the addiction to stop smoking. And it's
we all have worked in cancer centers, and I always remember a picture of a woman that was getting chemotherapy and has lost all of her hair at the same time as like smoking.
Right.
And it's like, what does it take to stop? And unfortunately, sometimes you may need to see the experts.
Yes.
I mean, it's the habit that is very difficult to break, but help is out there, and you really need to come to sense and get rid of it. You're basically hurting yourself. You know, you brought a very good point about, I'm going to see the doctor about screening. So of course, in my field of prostate cancer, we encourage people to go get their PSAs.
Right.
This is a good time if you're a 50-year-old to go and talk to the doctor, have a conversation, and see if you should have your PSA. Make sure that you get digital rectal exam. 15% of prostate cancers are found by finding some sort of firmness or a nodule. But certainly, and if you're at high risk, if you have family history of prostate cancer, you may actually want to do it even earlier, and that's a discussion with your doctor. Colonoscopy saves lives?
Yes, so colonoscopy should start at the age of 50. And then actually, nowadays, you don't need to go for possibly even 10 years for the second one. So there was a time when we were doing it every 3 years and every 5 years. So about 5 to 10 years would be the second one, depending on what they find. But again, if you have a family history or other issues if they found things on your prior colonoscopies, then you may have to go more frequently. But that's the general screening rule starting at the age of 50. And mammograms, for most people, are at the age of 40. We're starting screening. If you're high risk or you have a family history, you may need to start earlier. And again, that's a discussion to have with your doctor. And then also pap smears. So for women between 21 and 29, you would do a pap smear every 3 years, and then starting at the age of 30, they would do it yearly, and then periodically test for HPV.
If you start, this is a question that just came to my mind, if you start sexually being active at an earlier age, is there a time change as far as the pap smear, or that's not?
I think that they may start at the age of 18, but again, I think that's a discussion that is best had with your doctors, and I think a really important discussion to have if you're a mother of girls is to consider the HPV vaccine. I know there are some controversies surrounding it with potential side effects, but I think that it's an important vaccination for our kids because HPV obviously is the biggest risk factor for developing cervical cancer.
That's a very good point. So pay attention to all of that. And of course, one of the things that I promised myself as my resolution this year is to really get more sleep. I always say,
yes,
you should get 7 hours. Sometimes I go with 5.5 or 6 hours, and you have to be kind to your own body because sleep is very interesting because we don't think about it. Why is sleep so important? But lack of sleep has shown that actually can make you gain weight. Yes. You crave for carbohydrates. You get hungry faster. So this is a secret way of gaining weight and become obese. Right. And so pay attention to that.
Yeah,
that's very
it's actually
important.
also been shown to put you at an increased risk for diabetes and heart disease as well, believe it or not. Long-term, this is obviously long-term lack of sleep. But it also just affects, from a short-term basis, can affect your relationships on a daily basis. It's actually been shown to cause an increased rate of car accidents for those of us in driving communities. It affects your memory as well. So it becomes incredibly important to get that 7 to 9 hours. So recommended for above the age of 18 is 7 to 9 hours at night.
Let me just finish this segment by saying that when we talk about activities, as you mentioned, the American Heart Associations recommend those amount of activity, but also there are things that you can do by perhaps taking, stairs instead of elevators.
Yes.
I've been doing that, and it actually makes you take a few steps. Some of these wristbands and some of these Apple apps that are out there actually is a way to really motivate you. Getting one of these standing desks, I'm thinking about perhaps this year maybe a good way to maybe we're standing, because, you know, we're spending about 50% of our time sitting around. You're commuting, then you come to your computers, then you watch TV, then you're on your, you know, all these apps and etc. So get moving, and that would be like really a great way to increase your activities.
Right, absolutely.
Now,
any activity is better than nothing.
So easy to say to go out and have activities, but who wants to be out there in -4 degrees in New York? I never thought we would see this kind of temperature, and it's absolutely scary. Hypothermia is a real deal, and I'll tell you, last night I was out at a party, and they, you know, nobody could get your car, so I had to go out for literally, Sonara, 5 minutes.
Right.
And you start getting shivering, and you start getting and this happens so fast. You get tingling of your hands, and I know that we're in trouble, and I got to get inside quickly.
Right.
Have you had any experience with this? Because this is a real deal, like chilling factor.
It is very, very cold, and I have actually. You know, yesterday I was telling you before we started the show that I was filling up my car tires with air. Yes, I do that. Thanks to my dad, he taught me well. So
I'm impressed, actually.
Right? I know all 4 of them. And I have to tell you, by the time and it was 3 minutes at the most, my hands were in so much agony, and it was stiff. I couldn't actually put the caps back on. I had to leave and go home, and then put the caps on at home. But it happened so quickly, and the pain involved in your hands just kind of thawing out. So, you know, frostbite is a real thing, and obviously if you are becoming hypothermic, which means your body is less than 95 degrees, is a major issue. It can cause, like you said, tingling in your hands, tingling in your feet. It can actually cause slurred speech as well. Also feeling sleepy, having difficulty speaking, as I said. So these are all signs of hypothermia starting to set in. You want to get yourself into a warm spot as quickly as possible.
It really affects your entire organs. You know, you would see that there would be shallow breathing, they get shorter breath, heart rate starts to go down, and as time goes on, it can really affect a lot of your organs. The biggest thing is to go into heart failure, but as you said, it may affect your fingers, it may affect your, and this sets very quickly. So the best thing is, if you have any wet clothing, to first of all get inside. That's the first thing. Go indoor or go to the emergency room immediately. And what they do is they basically cover you with blanket to try to bring your temperature up. Our normal temperature is about 98 degrees, and anything lower than 95 is obviously very dangerous. The worst thing that you can do is, the tendency is, I'm going to jump into a very hot water, or sometimes they would put in these heat lamps right next to them to warm up, and that's really dangerous because you have lost the nervous or sensation in your hands or your feet, and it can cause burning of your skin. So you got to be very careful to very gradually bring the temperature up, and the experts in the ER can give you something to drink, you know, some warm drinks to bring the core temperature up. So that's.
And I think that we really have to watch the kids. So kids go out and they play, and as much as you have them bundle up, they don't realize that they're getting too cold. So you really, really want to watch the smaller kids. I had my daughter out, the baby out yesterday, and she was bundled up. And I have to tell you, the 30 seconds that I had her actually exposed to the air, she was really suffering. I mean, she was so uncomfortable. She was actually ended up crying. So that was the end of that. We went back home. But the bottom line is that, you know, the kids are very susceptible to it, and unfortunately they don't see the signs or recognize the signs and symptoms. So if you do have the kids out and they're starting to shiver, you want to get them in.
That's a very good point, and you want to pay attention, because when you have like a lot of snow, they could easily fall and they may not be able to get up, and in 5 minutes you can have a tragedy in your hands. So pay attention to that, and it's all about layers. I know we've talked about this many times. Get something that's really warm, wool content, multiple layers, until we get through this mess. It's really not pleasant. And I'll tell you something, for the first time, I bought a beautiful hat. Never owned a hat, for the record, and I put it on.
I'm sure it was beautiful.
I'm telling you, well, you gotta have like the whole class going. But I couldn't even get into my building. I couldn't get my car because everyone was looking at me like, who's that guy? So it's the funniest thing. All right, very briefly, I want to talk about like men's health at the beginning of the year, and we talked about the fact that women actually go and see their doctors, but men, you know, they come in, they want to have a very quick visit, they don't spend a lot of time, they have nothing prepared. So as a way to really find out what to tell your doctor, you should be asking some of these questions. You briefly touched about family history. If somebody comes to the office, the doctor will ask you, do you have any family history of cancers, heart disease, diabetes, other things? But bring up the importance of your family history, because based on that, he may be doing like earlier screening, or he may want to get your hemoglobin A1C, find out if you have diabetes or not. Important factor to touch base with your doctor.
Yeah, and that's actually just getting information from your family. And I mean, you guys don't like to talk a whole lot. Us women are full of words, so we like to talk. But men sometimes...
It's a different brain system.
Yeah, exactly. Ours is smarter. So it's definitely important to get the family history, you know, from your family members. And again, sometimes that becomes more difficult, especially for people that have been adopted. Obviously, they won't be able to get that information. But telling your doctors that information is so important, because it gives us an ability to establish risk factors for you.
And for prevention and the test that you're going to order, that's going to make a big difference.
Exactly.
The next question that comes up that you should really talking to your doctor is, am I up to date with my vaccines? And, you know, you talked about, for example, like people ask me, should I get my shingles vaccine?
Right.
What's the indications?
Oh, yes.
You know, flu vaccine, we recommend people get flu vaccine, but everybody calls me and say, it's only effective in 10-15% of the time.
Right.
Why do you keep telling us to get flu? Now, we are mandated to get that vaccine because we work in a hospital, but you should have a conversation, and in general, because of the entire society, when people don't get it, they can spread the flu.
Yeah, there's, you know, vaccines save lives. That's the bottom line. And maybe it's not, unfortunately, not everybody does have a, you know, gets prevented from getting these illnesses by getting the vaccines, but for the most part it helps the majority of us. So it is really important. The shingles vaccine, I can't wait till I'm old enough to get that shingles vaccine, because the patients really suffer with it. It's been shown to be very, very effective. So if you've had chickenpox, a history of chickenpox, I believe at the age of 60 is when you can get the shingles vaccination. There's also the pneumococcal vaccination, which becomes really important for our senior citizens to get that vaccination, because developing pneumonia as an elderly person can be very, very dangerous.
Absolutely. So, you know, we see a lot of men that come to the office and they talk about the fact that they're up all night, they're urinating, it's interfering with her sleep, it interferes with the bedroom. And the big thing that I tell them is, if you're a 60-year-old, about 50% of men out there at the age of 60, they have some sort of an enlarged prostate.
Right.
Now, they think, well, it's part of aging, I'm getting up 2-3 times. But the way we think about this nowadays is to really prevent you from getting worse. The time that when men used to die at the age of 70 has come and gone, and thanks to modern medicine and alternative medicine, they're going to their 80s and 90s.
Right.
So if you prevent it from getting worse, whether it's by medications or herbs or procedures that we have, we can save your bladder muscles and we can save your quality of life. And the fact that you can sleep much better and save your bladder for when you get to your 80s and not end up with all these catheters. Having that discussion is very important with your doctor.
You know, also in regards to screenings, David, I think is what, and we don't think of a lot, especially when we're in the midst of freezing cold weather, is skin cancers.
That's right.
So it's really important to go to a dermatologist on a yearly basis, or if your primary doctor is comfortable doing it, and have them evaluate moles and skin lesions to look for skin cancers, especially melanomas, which can be deadly. But some of the skin cancers are very faint and very subtle, so you may not know that you have it, but your doctor should, and you may need to get that biopsied. So very, very important.
Sinara, I'm so glad you brought it up, because I actually had a patient who had a lesion behind the ear, and thought it's always sort of like a pimple, and it was coming and going, but it wasn't really paying attention. And I think the daughter of the family said, "Dad, it's kind of like looks like it's not a good color," and that turned out to be a melanoma. And I've seen also people who may have lesions under their hair. So when you go to a real doctor, they really inspect, you know, the entire system from your hair all the way down to places where you may not be able to detect, and that can save your life. Melanoma is another thing that when you cut it out, either through Mohs surgeries or experts out there, dermatologists, they can cut it out and you'll be fine. Right,
exactly. But when it's caught too late, unfortunately, it can be deadly.
Another thing that comes up is, you know, sex drive. And as you know, as men get older, the level of testosterone continues to drift down.
Right.
So age is part of the reason why the libido can go down. But also a lot of people don't know that if they are under anxiety, they're under stress,
Right.
low thyroid can actually lower your libido. Or if you're on many medications, especially high blood pressure medications or anti-anxiety or depression, they may actually lose their libido. But we can check your testosterone. I always tell them to get your testosterone level before 9 o'clock because it can be lower at the end of the day. And depending on what goes on and what medical issues you have, we may supplement some of those testosterone and really give you the energy, and you're not going to be fatigued. You can hit the gym and you really feel good. Now, I'm not advocating that men should go out and get testosterone because there are a lot of side effects, but that's a discussion you want to have with your doctor.
Right, and for women as well. I mean, our libidos can be affected as well through age. Interestingly enough, our testosterone levels actually start to increase relative to our estrogen levels, which actually decrease.
That's not good for men out there. That's right.
No, we become much more assertive and aggressive. It's wonderful. But
you're funny.
But certainly but women's libidos certainly can be affected as well, and there are medical treatments to help improve that if it's a medical issue. And that's always a difficult discussion to have with your physician, especially your primary care physician. You may not feel as comfortable, but you should. They're open to that discussion.
Okay, so a couple of more things is that always ask your doctor, what did my lab show? Are you concerned about it? And finally, when should I come back? To close the loop at the end, always talk to your doctor. What are the findings? What do I need to do? And when do I come back? And I think that would be a good discussion with your doctor.
Yes.
We have a couple of other topics which we're not going to get to because with you, it's always easy and fun and time goes on. We only have like 4 minutes left. So we're going to, and I apologize from our viewers, hepatitis C and also like steps to reduce stroke we will discuss next week.
Yes.
Let me get to this big topic. It's controversial. There's a lot of debate about it. I think we should be civilized and have just a talk without any insult or attacking each other. But medical marijuana is a big topic.
Yes.
And there are pros and cons, and the country is kind of talking about it. I personally think that the train has left the station. 29 states they have legalized medical marijuana.
Yes.
7 states already have legalized recreational. California is the one that just approved it, I believe, this year.
Yes, started January 1st, and Colorado, of course, has been legalized for a while.
The question is, and I think Jeff Sessions is actually like making some comments about trying to slow down and get the attorney generals of the states involved in controlling this. Whether you agree or not, I think we should have a good discussions because I think that the kind of marijuana we're seeing today, or the THC, which is the main component of it, is a lot more potent than 1960s and 70s. And it's hard to know exactly how much of this you're getting, depending on where you go. But this kind of cannabis is finding their way to candies, to cookies, to drinks. And I think we need to be a little bit careful because of some of the side effects. Now, the minute you talk about the side effects of marijuana, people say, well, look at alcohol. Alcohol is legalized, or smoking is legalized. Leave me alone and don't take it away from me. I think that, even though we don't have a lot of long-term studies, but a lot of studies shows that it can affect your memory, it can affect your cognitive.
Yes.
Teenagers that have growing, developing their brain, it has side effects. What do you think about this?
Well, I think it has been shown to be beneficial. I mean, I deal with cancer patients, and I know that some of my cancer patients have found it to be beneficial in regards to the nausea and vomiting. So
post-chemo nausea, vomiting, it works.
Exactly. So it's been shown to be beneficial for that. It has been shown to be beneficial for chronic pain as well. So I can see the benefits of doing it, but I do think you have to do it very, very carefully. I think, number one, you need to get it from a licensed physician, or get and then also figure out the dose that's appropriate for you, because the side effects of it are dizziness, hallucinations, psychoses. And the problem is we actually don't know the long-term effects of using marijuana, even for just medical purposes, because we've never had the ability to study that.
So I agree with you. I think, for many patients, whether you have epilepsy, there are some studies that shows that it can actually help with kids that have seizure and epilepsy, that the modern medicine and medication hasn't been really helping. I'm okay with it. I think if it's, desperate and the kid is suffering, I think for patients that may have Crohn's disease and they're losing a lot of weight, this is a great way, or even patients with AIDS that can be really like losing weight. This is a great way to restart your appetite, etc., and your nutrition. Stage 4 diseases, I've seen people who are really stage 4 prostate cancer and other cancers that they're suffering from pain, and I think it would be helpful. But to kind of like get it out there, especially in our society where we're suffering from opioid crisis, and I'm not comparing this with opioid, but as a segue to other drugs, if it's not controlled under supervision of parents or the government, and for people to just jump on it because it makes you feel good, I think we need to be really careful and think about this. If you have opinions about this, we would love to hear from you on both sides of the story. You can go to Dr. Samadi TV, you can email your comments, and we will share some of that next weekend and see if we can have a smart, educated debate and discussion.
That would be actually really interesting to hear. I'd love to hear people's comments.
Absolutely. So believe it or not, the half hour is over.
I know,
the time
it's always so
flies
quick.
very quickly. Again, we look forward to seeing you next week. Sanara, thank you very much for your input. Happy and a healthy new year, and enjoy your weekend and your week. Thank you, guys.